Hello, couldn't unmute. Not like we haven't been doing this for a year. It's fine. So thank you for that introduction. Before I get started, I just want to level set with everybody, make sure everybody knows what I'm talking about here. So MAT is medications for addiction treatment or medication assisted treatment. SUD is substance use disorder. MHU is mobile health unit. Peer is a person with lived experience who is in recovery. And low barrier, high access is just a fancy way of saying harm reduction because not everybody loves the term harm reduction. It's a little scary for folks. So Front Range Clinic is the largest MAT provider in the state of Colorado. We follow a low barrier, high access model, meaning we really recognize that when folks are seeking care, we got to give it to them. That moment of readiness is not always prolonged. And so jumping on that is crucial to actually seeing people succeed. Additionally, any progress is progress. If you are drinking a handle of vodka a day and you get down to 3 shots a day, you deserve celebration. So Front Range Clinic has 3 types of clinics. We've got a brick and mortar, we've got pop-up clinics, and we've got mobile health units. In all 3 of these models, same services are provided. We offer medical services, both telehealth and in person. We offer counseling. This is all telehealth right now due to COVID. We offer peer support, which allows you to speak to somebody who's in active recovery themselves. We offer medications, and then we also do data collection for grants where that's applicable. So the brick and mortar clinic, just what it sounds like. It's a building, it's brick and mortar. This is where Front Range Clinic started. So we started with 1 clinic, 1 doctor in Fort Collins in 2014. And while we were there, we really started seeing more and more folks traveling from surrounding communities to seek care. So we decided to open a location in Longmont and Greeley, and the same thing happened. More and more people were coming from surrounding communities. So we trickled down I-25 and now have over 20 locations in the state, 20 brick and mortar locations. And then we also have 1 in Farmington, New Mexico. Another unique thing that we do is pop-up clinics or embedded clinics. And how we did this is we leaned on established relationships and developed the relationships that we had in the community. And we utilize the spaces of these agencies. So all of these agencies, all they have to do is provide us with a private space and access to a bathroom. We come into their facility, we set up clinic in a bag. That's why we've got this little suitcase. We bring the clinic in the bag, we set up, and we see patients on site. So a peer administrative staff member shows up, sets everything up, and engages with the patient. This really allows us to build trust in a unique way because we're leaning on the trust and the rapport that already exists between that individual and the agency. Some of our community partners include homeless shelters, syringe exchange programs, recovery communities, mental health facilities, county jails, CERT and IRT programs, as well as residential programs. So these are all facilities that we actively go into their space and treat patients on site. You can see we have about 15 pop-up clinics in the state. This is that cute little bag I told you. They take their little suitcase, they set up shop, and provide services on site. So you can kind of see that it looks a little bit different in every space that we're in. Then we have a mobile health unit. So in 2019, the Office of Behavioral Health in the state of Colorado opened up a grant for mobile health units. There's 6 in the state of Colorado. Front Range Clinic manages 4 of the 6. These units are staffed with a peer, a counselor, a nurse, and what they do is they go to bed every night in their hometown. So they go back to home base, they go to their garage, they go to bed. In the morning, they get up and they travel to the rural communities that they serve. They go 1 day a week to each rural county, or excuse me, each rural community, same time, same place every week. This was a real big test and outreach. You know, when we started these mobile health units, we were, again, specifically engaging with rural communities. And so shout out to Dr. Liz Gilbert, because I totally learned this from her. But as we build relationships with their communities, we really allowed the communities to be the experts in their community. We were the experts in addiction treatment. They were the experts in what their community needed and how we were going to appropriately engage in those communities. We could not have done it without them. We had to find parking spaces for a 34-foot unit. We also had to build contingency plans because I know it's shocking, but mobile health units, when they break down, they don't get fixed super quick. Take a long time. So these are all of our mobile health unit routes in the state. So you can see we're serving over 25 rural communities using a mobile health unit. These are what they look like. They're super fun. And this is a unit out in the wild. So as you can see, it travels to pretty rural communities, finds a parking space, and provides treatment. Now, what we did find is, as you probably most know, the state of Colorado is super diverse in its terrain, and driving a 34-foot RV through the mountains is not a good idea. It's not safe. It's not fun. So we took a hybrid model of the pop-ups and the SUVs, found community partners where we could do these pop-up models in order to still provide services to those communities without risking the safety of driving the unit. All in all, we have over 60 unique locations in the state since 2014, and really excited to serve people like where they are. Thank you.